Third-party reproduction refers to reproduction that uses a source of either the eggs, the sperm, or the uterus from another person outside of the couple. So for instance, if a couple comes to us and the male has no sperm, then we would use third-party reproduction to call the process artificial insemination with donor sperm the treatment of choice, where we would take sperm from another male, usually from a sperm bank, and then we would put that into the uterus of the woman right at the time of ovulation in order to obtain conception. Or sometimes we have women who come to us in their 40s and they're out of eggs. They no longer make them. So what we do in that case is we get a donor of eggs to supply the part that's missing, the eggs, and then we fertilize those eggs in the laboratory and with her husband's sperm, and we put the embryos back in the uterus. That's another form of third-party reproduction. Still another part of third-party reproduction is when a woman comes to us and either she has a non-functional uterus, the uterus is absent, or she has medical conditions that preclude the option of carrying the pregnancy herself. In those situations, what we do is we have a gestational carrier. A gestational carrier is a woman who's not related to either the eggs or the sperm, but can carry the pregnancy. We can get the eggs from the woman, the sperm from her partner, fertilize the eggs in the laboratory, develop them into embryos, and then prepare another person to carry the pregnancy, prepare her uterus so we can then put the embryos back into the uterus at the appropriate time, and she can carry the pregnancy for the couple. Same-sex female couples that come to us have the option of fertility from a couple of ways. One, if the woman wants to carry the pregnancy herself, we can do artificial insemination with donor sperm, where the couple chooses donor sperm of their choice from sperm banks that we use, and then we prepare the sperm to put into the uterus right at the time of ovulation, and then we maximize the likelihood of pregnancy each time we do an artificial insemination with the donor sperm. Other options that we have are sometimes women come to us, same-sex couples, that have problems with their eggs, and sometimes they can use donor eggs or they can use eggs from their partner. And we can do IVF in both instances, using either the donor eggs or eggs from their partner to result in conception for them. Other times, patients want to do reciprocal IVF, where one woman wants to carry the embryos from eggs produced from their partner, and we can do that as well. Same-sex couples who come to us for treatment go through the same type of evaluation as any other couples that come to see us. We order a specific number of tests that are directed to determine what their fertility potential is, so that if we find any deficits, we can overcome that with the treatment. Once we have the entire repertoire of tests completed, what we do is we sit down with the patient, go over all the details of the test results, talk to them about what they want, and then we target a treatment directly to solve the problems that they particularly have themselves.